Hi, my name is Ellie Cizik, and I will be presenting data regarding the healthcare system of France in contrast with the healthcare system in the United States. To begin, when it comes to healthcare and insurance, both of these countries do healthcare very differently. The French healthcare system is a combination of universal healthcare and private insurance coverage. Health insurance in France is compulsory, meaning that its residents cannot opt out. Its residents are also automatically insured based on occupational status. The United States healthcare system is not universal, and its residents are privately insured, even if it is financed by the government. When looking at the life expectancy of a country, it gives an indication of the overall health of its population. In France, the life expectancy overall is 82.7 years. The life expectancy of the female population in France is 85.6 years. The life expectancy of the male population in France is 79.8 years. In the United States, the overall life expectancy is 79.8 years, 0.5 years. The female population life expectancy in the United States is 81.8 years. The male population life expectancy in the United States is 77.3 years. In comparing the life expectancies of these two countries, it is clear that France has higher rates of life expectancy in overall and female and male categories. In regards to healthcare spending and total healthcare spending per capita, France spends $4,600 per capita on healthcare. The United States spends $10,348 per capita on healthcare. Wealthier countries tend to spend more money on healthcare per capita than countries that tend to have lower incomes. There's obviously a very large gap between the total healthcare spending per capita between these two countries. The US has similar public spending compared to other countries when it comes to healthcare. However, in regards to its private spending, it is almost triple that of other countries. When it comes to prevention efforts in the healthcare system, especially when it comes to the flu and immunization, in France, 49.8% of its population that are aged 65 and older have gotten the flu shot. In the United States, 69.1% of its population aged 65 and older have gotten a flu immunization. Like I said, this statistic comes from the percentage of the population aged 65 and older who have received their annual flu shot. In addition to flu immunization, when it comes to public and health prevention, especially chronic disease prevention efforts, in France, there are multiple policies in place that play a role in prevention and management of chronic diseases. First, the Public Health Act of 2004 created a number of health plans with specific targets. 11 of these targets were dedicated to chronic diseases. It created the National Cancer Institute and also gained a focus on prevention, screening, quality of care, and patient-centered care. Additionally, the Hospital Patients Health and Territories Act of 2009 created a plan for patient education and also defined content for these patient education programs. In the United States, the National Center for Chronic Disease Prevention and Health Promotion focuses on 4 domains. These domains include tracking, improving, strengthening, and connecting. In more detail, these 4 domains include tracking risk factors and chronic disease rates by conducting research, improving environments, to promote healthy lifestyles, strengthening healthcare systems and prevention services, and connecting clinical services to the community for management of these chronic diseases. In regards to the physical environment and the housing situation in each of these countries, in France in 2013, there were 216.77 per 100,000 people who were homeless and without adequate housing. The French government housing strategy includes these 3 pillars to help improve this homelessness situation. Pillar 1 states, build more, better, and cheaper housing to trigger a supply shock. Pillar 2 states, meet the needs of every individual and protect the most vulnerable. Pillar 3 states, improve living conditions. In the United States in 2013, 177.1 per 100,000 people were homeless or living without adequate housing. The National Law Center on Homelessness and Poverty is committed to finding a solution. They have 3 strategies that will help them find this solution. Strategy 1 is to impact litigation. Strategy 2 is in regards to policy advocacy. Strategy 3 is involved with public education. When it comes to access to care and the rate of uninsured adults in both of these countries, in France, due to its universal health care, all legal residents are insured by Social Health Insurance, or SHI. The package of services is broad, but varies depending on the specific service provided. In the United States, 8.8% was living without health insurance in 2017, so it is clear that in France, it is much easier to get insurance just by being a resident of the country. In regards to the social and economic environment and unemployment rates, in France, the percent of people in the labor force that are unemployed is 9.1. In the United States, the unemployment rate is 3.8. These people consist of those who are without jobs and are able to participate in the labor force. When comparing and contrasting the countries of France and the United States and their healthcare systems, I've come up with these few takeaways. First, the life expectancy of France is higher, and the healthcare spending is significantly lower than that of the United States. Also, France insures more of the population due to its universal healthcare coverage. In prevention efforts, the United States seems to be ahead due to their higher immunization rates, lower unemployment rates, and fewer homeless individuals. Thank you.